Well, I think the C3 meeting is a premier meeting. It really is a great meeting. We have a very large faculty. I'm always almost overwhelmed with the talent and the vast number of the world leaders who are here lecturing at C3. And of course, that leads to an amazing agenda curriculum that Dr. Dave's put together that really attracts many people here to Orlando. And of course, maybe some of the kids want to go to Disneyland too.
Well, C3 is great because it has excellent attendance, but it's a comfortable attendance. And so you can interact with the speakers in the hall, and it's very international. And so you really get perspectives of other countries and what's going on. And sometimes we don't have all the ideas here in the United States. So it's very helpful to have this. So I think it's an excellent conference that brings out a lot of new ideas, but gives you the flexibility of talking to people.
Well, the C3 is a fantastic meeting. I must congratulate Dr. Rajesh Dave, who's a good friend, to organize such a meeting which discusses not only all the complexities of catheter interventions and the emerging technology in this area, but he also has thought of and put a general cardiology section, which is where I was lecturing, and there are enough attendees there to really broaden the knowledge of even the interventional cardiologists to general cardiology, because it's all very important. You can do a very complex catheter procedure, but if you don't manage the other aspects of the patient, then the benefit will not be achieved to the greatest extent. So I must congratulate him for planning such a nice meeting, and certainly clearly the attendees I've talked to have enjoyed it very much as well.
So the C3 meeting is one of my favorite meetings. It's based in Florida, and I'm a local resident of Florida, so it's a convenient meeting. But it's also, one of those meetings which is large enough and yet small enough to where you can interact with the attendees and have a very personal communication and interaction with people from all over the world. So it allows for that intimate connection with other colleagues and participants, and it's not big enough to where you get lost in the meeting.
C3 is a very successful Congress. They have, over the last 15 years now, developed a core curriculum of the complete breadth of interventional cardiology topics. And they have the world's who's who and experts on the stages, teaching you the evidence that's out there in a very cozy format. It doesn't feel like a scattered technique like a train station. It actually feels more like a homebound conference.
So the C3 meeting is a very big and great meeting covering cardiology and peripheral artery disease. So from that standpoint, and I organized the Venus part within that C3 Congress, I must say I was impressed about the number of attendees, I was impressed about the presentations, and I was impressed that so many colleagues came from all over the world to this place to discuss the current topics within cardiology and endovascular questions.
Well, I love C3. I was here at some of the very first meetings. It has not changed much in the spirit, which is very collegial. There's a lot of conversation. Everyone talks about key opinion leaders. That's not what's important. I call them key hallway leaders. Who's talking to who in the hallway? That's where most of the important information exchange occurs. Outside of the room. And this conference makes people much more accessible. It's much more intimate, and I think that's a reason why so many people gravitate to this conference time and time again.
This is my 5th or 6th years here at the C3 meeting, and this is an exciting meeting. Raji has done a perfect job as usually. I take with me in Italy a lot of information about a lot of data, new data, so I hope to incorporate quickly this data in my clinical practice in the future.
Well, this is a terrific conference. I've watched it grow over the last several years. I particularly enjoy the young people's presentations of their work. This is a way to instill passion and excitement because the the guys my age are going to be drifting out of the scene, and we need somebody to replace us. And I have to say that the international flavor of the meeting is also fantastic. I think it's very important in bringing worldwide cardiology together. So it's been a great experience for me, and I'm thankful to the organizers for inviting me to the program.
The C3 Congress has just continued to expand. It remains one of the foremost destinations for practicing cardiologists, especially those who want to get hands-on and a close experience with experts in the field. I've seen general cardiology explode in this meeting, really key information, top line, as well as all the interventional theaters, live cases, new technology. It's a great gathering of minds to come to in Orlando and get really updated.
Oh, that is a long-lasting experience. I am coming every year from at least 12 years, and I have seen growing up this meeting from small meeting to big meeting. Not only big, but it's also the high level scientific level, organization, and attendees also increasing every year. I think it is one of the let's say one of the most interactive between attendees and speakers in interventional field. But actually it's not only interventional field, because there's also clinical cardiology updating every year. And I would say that I am really happy to be member of this meeting from more than 12 years.
Yes, we come to this conference since many years. It's a fantastic conference to the perspective that people share their everyday experience in the cath lab or the interventional suite, and it puts together a large community of interventionalists coming from all over the world. People coming from Europe, people coming from Asia, people coming from South America, people coming from Africa, people coming from the whole North American continent. They are all together in this fight against disease, atherosclerotic disease in multiple vascular beds. So this makes this conference somehow unique. It's extremely informal in terms of sharing cases, discussing different approaches, and trying to pass this to the next generation of practitioners.
Well, I think Raj Dave has done a phenomenal job with C3, and he was kind enough to offer me a faculty position here many years ago when I was a young faculty member, and I've gotten grayer over the years. But in his 15 years, C3 has grown into a very well-recognized international trial, international congress that has brought together the leaders in most every field. Initially coronary disease, and then peripheral vascular disease, and now structural heart disease. And the Congress itself has actually grown as the technologies have grown, but more importantly, what we can do for our patients has grown. And I'm just absolutely honored to be a part of C3. So Raj, in all his endeavors, as being a very busy man, has really grown and produced a really phenomenal Congress that I think every year I look forward to coming and being a member of, and a very honored, humbled member to be a part of this group.